Hello everyone, welcome to Anima Anatomia Skull Bone series. Today in this video we will see about these contents. First, inferior nasal concha, mandible and paranasal sinuses. So we will briefly discuss one by one about these topics. The first one is the inferior nasal concha. So as we all know, in our nose we have the three concha: superior concha, middle concha and inferior concha. Among these concha, the inferior concha is formed by the independent bone. These are the two curved bony laminae which are placed horizontally in the lower part of the lateral wall of the nose. And between this concha and the floor of the nose, there lies the inferior meatus of the nose, and it comprises of two surfaces, two borders, and two ends. We will briefly discuss about these two surfaces, borders, and the ends. Firstly, we will talk about the surfaces. So, there are the two surfaces, medial and the lateral. The medial surface is convex while the lateral surface is concave. And the medial surface is marked by the vascular grooves, and the lateral surface forms the medial wall of the inferior meatus. Now, the two borders are superior border and the inferior border. The border is irregular and it articulates with maxilla, lacrimal, ethmoid, and the palatine bones, while the inferior border is free, thick, and spongy. And we have the two ends in the inferior nasal concha. So these two ends are anterior and the posterior. Posterior end is more pointed than the anterior end. Now let's move forward towards the mandible. So mandible is the largest and the strongest bone of the face, which is developed from the first pharyngeal arch, and it is the second bone to ossify next to the clavicle. In the mandible, we have the two parts, the body and the ramus. The body is horseshoe shaped and it lodges teeth, whereas a pair of rami provide attachment to the muscles of the mastication. In this diagram, you can see this is the body and these are the ramus, or we can say a pair of rami. Now, let's talk briefly about the parts. Firstly, we will talk about the body of the mandible. So, the body of the mandible consists of two surfaces and two borders. The two surfaces are outer, inner, and two borders are upper and the lower. Now, the outer surface. The outer surface presents the following features. It is symphysis manti. It is a line at which right and the left half bone meet each other, and the second is the mental protuberance. It is a median triangular projecting area in the lower part of the midline, and the third is mental foramen, which lies below the interval between premolar teeth, and the fourth one is the oblique line, which is a continuation of the sharp anterior border of the ramus of the mandible. And the last fifth is incisive fossa, which is a depression that lies just below the incisor teeth. In this diagram, you can see the outer surface of the right half of the mandible. Here you can see the mental foramen, mental protuberance, oblique line. Now we will moving forward towards the inner surface of the mandible. The inner surface of the mandible consists of mylohyoid line, which is a prominent ridge run obliquely downwards and forwards. In this diagram, you can see the mylohyoid line, which is run obliquely downwards and forwards. Now, the second is submandibular fossa. Submandibular fossa presents below the mylohyoid line and lodges submandibular gland. As per the name, you can see submandibular fossa. So, submandibular fossa consists of submandibular gland. Here in this diagram, you can see here is the submandibular fossa, and it is below the mylohyoid line. And third is the sublingual fossa. It is present above the mylohyoid line, which lodges the sublingual salivary gland. This is the sublingual fossa. Now we have the genial tubercles. These are present on the posterior surface of the symphysis manti, which is marked by four small elevations. And these four small elevations are known as the genial tubercles. In this diagram you can see the genial tubercles. We have the superior and the inferior genial tubercles. And the last we have the mylohyoid groove, which is present on the ramus, but it extends onto the body below the posterior end of the mylohyoid line. In this diagram you can see it is a mylohyoid groove. Now we have the two borders, the upper border and the lower border. The upper border is also known as the alveolar border, which bears sockets for the teeth, while the lower border is also known as the base, which shows an oval depression near the midline called digastric fossa. Now we have the ramus. So basically, ramus, it is a quadrilateral in shape, and it has the presenting parts like two surfaces, four borders, two processes. Two surfaces are lateral and the medial, while four borders are upper, lower, anterior, posterior, and the two processes, coronoid and condyloid process. We will briefly discuss about these surfaces, borders, and the process. Let's start with the surfaces. So as I told you, two surfaces, lateral and the medial. The lateral surface is flat and bears a number of oblique ridges, while the medial surface, it consists of the mandibular foramen, which leads into the mandibular canal, and anterior margin of the mandibular foramen is marked by a sharp tongue-shaped projection. This sharp tongue-shaped projection is called lingula. And you in this diagram you can see lingula. So here is the lingula present. It is present near the mandibular foramen. Now in mylohyoid groove begins just below the mandibular foramen. In the same diagram you can see the lingula, and below the lingula there is the mandibular foramen, and below the mandibular foramen what is present? The mylohyoid groove. Now we will talk about the four borders. These four borders are upper, lower, anterior, and the posterior. The upper border is thin and curved downwards, forming mandibular notch, while the lower border is a backward continuation of the base of the mandible, and anterior border is thin while the posterior border is thick. Now we will talk about two processes. These two processes are coronoid process and the condyloid process. The coronoid process, it is like a crow's beak. The meaning of the coronoid is crow's beak, and it is a flattened triangular upward projection from anterior superior part of the ramus. And the condyloid process, it is knuckle like process, and it is a strong upward projection from posterior superior part of the ramus, while and its upper end form the head, which is covered with the fibrocartilage and articulate with the temporal bone to form the temporomandibular joint. As we say, it is TMJ joint, temporomandibular joint. In this diagram, you can see the right condyle or the condyloid process and the coronoid process. This condyloid process forms a temporomandibular joint. Now moving forward towards the last topic, that is the paranasal sinuses. Firstly, we should know the definition of the paranasal sinuses. The definition is these are the air-filled cavities which are located in the bones around the nasal cavity, and the bones around which these cavities are located are ethmoid, frontal, maxilla, and sphenoid. These are lined by the respiratory mucosa, which is continuous with the mucosa of the nasal cavity, and they drain into the nasal cavity through relatively small apertures. And the drainage of the sinuses mainly depends on the movement of the cilia, which propel the mucus towards their openings in the nasal cavity. These sinuses are rudimentary or even absent at birth, but they enlarge rapidly during the age of 6 to 7 years and then after the puberty. Now we will talk about the functions. What are the functions of these paranasal sinuses? The first is they make the skull lighter as the sinuses are filled with air. So they help in reducing the weight of the skull. So they make the skull lighter and warm up and humidify the inspired air. As we inspire the air is not warm or humidified. So the work or the function of the paranasal sinuses is to warm up and humidify the inspired air. These also add resonance to the voice. Now we have the four paranasal sinuses. In this diagram, you can see the all four paranasal sinuses: the frontal sinus, ethmoid sinus, maxillary sinus, and the sphenoid sinus. We will briefly discuss one by one about these sinuses. Now let's start with the frontal sinus. So the frontal sinus, it lies in the frontal bone and they are situated posterior to the superciliary arch. Posterior to the superciliary arch, and it extends upward above the medial end of the eyebrow. Remember, medial end of the eyebrow and backward into the medial part of roof of orbit. And where this sinus open? The frontal sinus opens into the middle meatus of the nose at the anterior end of the hiatus semilunaris through infundibulum. What is the surface anatomy of this paranasal sinus or this frontal paranasal sinus? It is a point 3 centimeter above nasion and the junction of the medial third and lateral two-third of the supraorbital margin. What are the vasculature and the lymphatic drainage? So the arterial supply of the frontal sinus is supraorbital artery and the venous drainage is supraorbital and superior ophthalmic veins. The lymphatic drainage is submandibular nodes and the nerve supply is given by the supraorbital nerve. Now moving forward towards the second sinus, that is the maxillary sinus. Maxillary sinus is largest of all the paranasal sinuses and first to develop. It is pyramidal in shape and with its base directed medially towards the lateral wall of the nose and the apex directed laterally in zygomatic process of maxilla. Where the sinus open? This sinus opens in the middle meatus of nose in hiatus semilunaris and the roof formed by the floor of the orbit which is traversed by the infraorbital nerve and the floor of the maxillary sinus is formed by the alveolar process of the maxilla. The vasculature is the arterial supply is given by the facial, infraorbital and greater palatine arteries, whereas the venous drainage is done by the facial vein and the pterygoid plexus of the vein, or we can say pterygoid venous plexus, and the lymphatic drainage is by the submandibular nodes. Now moving forward towards the third sinus, that is the sphenoidal sinus. The sphenoidal sinus, these are the right and the left sphenoidal sinuses which lie within the body of the sphenoid bone, and each sinus opens into the sphenoethmoidal recess of corresponding half of the nasal cavity, and it is related superiorly to the optic chiasma and hypophysis cerebri and laterally to the internal carotid artery and the cavernous sinus. The vasculature of the sphenoidal sinus is the arterial supply is given by the posterior ethmoidal and the internal carotid arteries, while the venous drainage is into the pterygoid venous plexus and the cavernous sinus. The lymphatic drainage is by the retropharyngeal nodes. Now the last one, that is the ethmoidal sinus. The ethmoidal sinus, these are the numerous small intercommunicating spaces which lie within the labyrinth of the ethmoid bone, and these are subdivided into anterior, middle and posterior. The anterior ethmoidal sinus, middle ethmoidal sinus and posterior ethmoidal sinus. Now firstly the anterior ethmoidal sinus. The anterior ethmoidal sinus is made up of 1 to 11 air cells, and These air cells opens into the anterior part of the hiatus semilunaris of the nose. Now, the middle ethmoidal sinus. The middle ethmoidal paranasal sinus consists of 1 to 7 air cells, and these 1 to 7 air cells are opens into the middle meatus of the nose in bulla ethmoidalis. And the last, posterior ethmoidal sinus. This is also consists of 1 to 7 air cells and opens in the superior meatus of the nose. The anterior and the middle ethmoidal sinus is supplied by the anterior ethmoidal nerves and vessels, whereas the posterior ethmoidal sinus is supplied by the posterior ethmoidal nerves and vessels. There is a short clinical anatomy about these sinuses, as the infection is very common. So, the infection of the sinus is known as the sinusitis, and it causes headache and persistent, thick, purulent discharge from the nose. The diagnosis is assisted by the trans illumination and radiography. In the radiography, we can see a diseased sinus as appeared as opaque.